So we'll have a series of videos on the penile fillers. As per a recent survey, around 55 to 60% of the men are not happy with the size of their penis. And many men, in fact, in my clinic do come asking for enlargement of the penis. And as I've discussed in my previous videos, girth enhancement is possible and the outcomes are quite good, whereas the length enhancement can be done only in selected individuals. So what do we do to enhance the penile girth? So mainly we use the penile fillers, and the first video deals about the various types of fillers and their origin. So in the fillers we have the autologous fillers, wherein your own fat is used and then that is processed and then that is injected. And in the biological group, we have the hyaluronic acid, which is the most commonly used penile fillers. Apart from the andrology, it is mainly widely used by the dermatologist on the face for facial enhancement as a fillers on the face. So, and the third is we have the synthetic penile fillers, which mainly involves the polylactic acid. So among the autologous, biological and synthetic, the most commonly used and easily available is the biological penile fillers, which is the hyaluronic acid. The word acid doesn't mean that we are actually using some acid. That's how the generic name is. So it basically comes as a liquid or a gel, and we inject it under the layer of the penis so that you get a good girth. The most commonly used filler is the hyaluronic acid, and it has two origins or the two sources. One is from the animal source, which is from the chicken comb, and the second one is the non-animal derived, which is basically obtained by the biofermentation of the Streptococcus bacteria. So that's how they obtain the hyaluronic acid. Even otherwise, the hyaluronic acid is present in multiple places in our body, including the skin, eyes and the connective tissues, and also in the joints. So hyaluronic acid is naturally available in our body, but to extract it, usually we choose either an animal source or a non-animal source. And we always prefer to use a non-animal derived hyaluronic acid, which is usually better and has less allergic reactions.